We begin with drama at the Ministry of Health. Angry patients from KNH stormed a media briefing organized by the Cabinet Secretary for Health to protest their difficulties in accessing SHA services. The patients, some of who carried their newborn babies, lamented over the glitches in the SHA portal that caused delays in patient clearance and administrative services. Now, the breach raises concern over how they can access highly guarded wing, which hosts the CS's official boardroom, which requires biometric to access. Let's start our broadcast with our very own Mary Morky.
Coming here for treatment. From last week, Wednesday, the systems are not working.
In a daring and never seen before attempt to have their grievances against SHA heard by the real decision makers at the Health Ministry,
this man has a child.
Angry patients from the Kenyatta National Hospital stormed the boardroom at Afya House, where the health CS and top officials in the Ministry of Health had just concluded a press briefing where, ironically, among other issues, the health bosses elaborated on the success of SHA, the patients lamenting on the pain and suffering SHA has visited upon them.
It is not working. They are not approving. We have walked all the way to NHIF. We have been told that they are unable to access the portal. We have been in Kenyatta waiting for that portal to open, and it is not opening, it is not working. Please be aware, it is not working.
Pesa inaingia, ukilipa SHA, you're told lipa 6 months upfront. Ukilipa SHA inaingia, pesa inaingia, hiyo haihang. Lakini matibabu tupate Kenyatta, sababu ya nini? SHA haifanyi, sijui OTP haijatumwa, sijui nini. Over there we are many people working. Hapo Kenyatta wako nje, hawasaidiki, sababu ya nini? Hawezi saidika unless SHA ikuwe approved.
Among the patients who stormed was a distressed mother of a 10-day-old baby who had undergone a cesarean section and was unable to leave the hospital due to unresolved billing issues.
SHA thing. So tusaidie. We are going through a lot. Huyu mbaba mtoto wake alimeza koi. Hajashughulikiwa kwa pale Kenyatta. Akikufa sababu ya hiyo SHA.
Na mtoto hajakula kutoka jana.
It is not fair.
Gone to the pre-authorization. They are not able to give us any access. They are not able to get into the portal.
Mnazungushwa ukienda kwa hiyo ofisi go there because they know very well hautasaidika.
Ironically, their unceremonious visit here at the Ministry of Health headquarters preceded a report by the Director General of Health, Dr. Patrick Amoth, and Health CS Dr. Deborah Barasa on the SHA progress report and how the new health scheme had improved healthcare access across the country.
We're looking at affordable, accessible quality care. Accessibility is really critical, seamless implementation so that all Kenyans can be healthy and that we are leaving no one behind.
So health coverage is one of the key pillars of the Kenya Kwanza government. The commitment that was made that we achieve universal health care. Based on that, we developed critical pillars for delivery of universal health care through the Taifa Care model.
We have so far collected more than 20 billion, and we have, like the DG had said, been disbursing, and we continue to disburse to hospitals.
Something called SHA. She's carrying the baby everywhere she's moving.
The patients, however, say that is not the case, and the experiences at Kenyatta have been nothing but horrible. The Kenyatta National Hospital has since issued a statement admitting to a lapse in patient care due to SHA-related outages and assured all patients that services have been fully restored. The statement signed by the CEO, Dr. Evanson Kamori, further says that the system downtime experienced over the last 2 days caused delays in patient clearance and administrative processes. This played out even as speculation is rife of infighting at the Ministry of Health, pitting the CS and the Principal Secretary of Medical Services, Harry Kimtai, gave conflicting directions on the appointment of Andrew Mulwa to NASCOP, with Barasa revoking the deployment of Mulwa, former KEMSA CEO, which had been made by Kimtai.
Hakuna kupigana. Hakuna kupigana. So the deployment, reshuffling of the staff is there. And everyone has their concerns. We routinely engage as a ministry. Unfortunately, our PSS could not be available, and that is because there was another meeting at State House. I can assure you there is fruitful discussion among the top leadership.
Questions linger on how the angry patients were able to access the highly guarded executive wing where the CS office and boardroom are located. The entrance is manned by 2 armed administration police officers and requires biometric access to enter. The storming of Afya House by disillusioned patients is the strongest indication yet that the transition from NHIF to SHA still has a long way to go. Mary Mwoki, Citizen TV.